would be applicable. And I'm trying to determine how so many people who really, I'm talking about people that are running this country who haven't really even read the bill, have absolutely no idea what it's going to cost if that bill passes.
Okay.
What the American people are going to have to pay, and whether it's going to even work because they haven't even read it. And turning the health care over to a state-by-state, governor-to-governor decision-making process, and then having to push it down people's throat to the point where, boy, we've got to get this passed by the 30th, or we're going to go from 51 votes to have 60 votes to get it done. And it's all in the name of, we need to show that country that we can at least get something done, even if it's wrong.
I'll do my best to answer your question, but I want to come back to the word politicize. When I say politicize debt ceiling with creating a budget and doing flood insurance, it becomes the question of because anybody that, I mean, you're not going to vote to shut the government down, or you're not going to vote to fail to pay the nation's debt obligations. I mean, I don't know of a member of Congress who wants to be if there's one, the deciding vote that the country defaults on its debt obligations. Now, there's a lot of people that vote no on debt ceiling. I'm not one of them. There's a lot of people that do. And why do they vote no? They vote no because they don't want to go back to their districts and have somebody say, why'd you vote to raise the debt ceiling? Okay, so they vote no. So they can say, I didn't vote to raise the debt ceiling. They never have to own the no vote. If their no vote sank the debt ceiling and forced the government to default on its debt obligations, then it would be an entirely different conversation that they don't want to have. I call these people respectfully the vote no, hope yes caucus. They vote no because they know it's going to pass, and they can kind of go home and say, I didn't do that. They did. If they had to go home and say, well, I sank it, and the country defaulted on its debt obligations, and our credit rating has gone to hell in a handbasket and whatever, then they don't want to have to own that vote. So when I say politicize, that's what I'm talking about. As regarding health care, that's an easy vote for me. Because I know what's going on with Obamacare. I know what the Affordable Care Act is doing to the majority of the people that I represent.
You don't think that can be improved on?
It has not, there are too many provisions that are insufficient for long-term sustainability of the Affordable Care Act. And I'm going to tell you right now, it's going to happen. It's going to happen sure as I'm standing here, and we can debate it, we can discuss it, we can disagree all day long. But I know premiums are going higher, deductibles are going higher. In fact, health care that we are subsidizing for some people cannot be accessed. The only way it can be accessed is if somebody has enough of a health problem where they have to pay thousands of dollars that they don't have out of pocket before their coverage even kicks in. That is not an accessible healthcare system, in my opinion.
Why would every major healthcare organization in this country be opposed to the Graham Cassidy?
It's money.
Well,
It's about money.
It's about money.
Now, look, this is a very deep discussion and could consume the next day if we wanted to have this discussion.
I agree.
But let me just put it this way. For those of you that have ever had recently some kind of an illness, not just a doctor's office visit, but I'm talking about maybe a hospitalization or something where you've received an EOB, an explanation of benefits, back to your home from your insurance company and from that hospital. And just go line item by line item of the charges. There is no possible way that a lot of these providers that are in it on money can justify the costs associated with the charges that they're sending to these insurance companies. No way. I mean, I've seen it. In fact, personally, I just paid off. My son, bless his heart, hurt his shoulder. Didn't know how bad he hurt it, but it hurt. And the kid went to the ER. And he calls me and says, well, Dad, I just want you to know I went to the emergency room. For what? And he said, well, I hurt my shoulder. I said, what'd you do? Well, I fell off the couch or something and it was hurt. And I said, why would you even think about going to the ER? It's not an emergency. Your shoulder's hurt. Go to the doctor in a couple of days. Take some Tylenol. And then I had to explain it to him in financial terms. I said, Bradley, it's going to cost $1,000. Sure as I'm sitting here. How long were you in there? Well, maybe an hour. And what they did? Well, they took an x-ray of my shoulder. And what's wrong with your shoulder? Well, nothing. They just told me to put a little ice on it. I just paid it off. $1,000 of charges. You can't justify that. But this is where healthcare is right now. And it's a complicated subject, and it depends on who you are with the question as to what the answers are. If you're a provider, of course you don't like Graham Cassidy, because you don't want to let states start dictating what you're going to have to cover or how much they're going to pay and those kinds of things. The country has just gotten so far away from the intended purposes of Medicaid, as an example, that if you don't fundamentally change the formulas, then it is just not a sustainable program at all. And the worse it's going to get is that more and more people are going to lose their doctors, and they're going to start losing their insurance, and carriers are going to be pulling out because of all of these mandates. And the fact is, most people are going to choose not to even participate because they're healthy and they're young, and these were the people that we were supposed to be getting into the system to help pay for those that needed it.
Aren't there going to be variables with relation to pre-existing conditions?
It will, but let me tell you, the country, in my opinion, has to establish some kind of coverage program for the pre-existing community. But let's just put it on the table. When Obamacare was passed in 2009, I don't know what the number is, 70% maybe, more or less, of people that had health insurance that they liked and a doctor they liked got their coverage from where? From their employers. And they were happy. But yet, for some reason, we chose, in order to expand Medicaid and rewrite those rules, and to guarantee payment to all these providers, that we were going to put that on the backs of a lot of people who were already happy with their coverage. And instead of just dealing with the subset of problems, we just painted with a broad brush. And we said, you're going to have to cover all of these 10 things, insurance companies, and you can't tailor these plans to meet the needs of the clients. We still haven't been able to sell it across state lines to enhance competition. We still haven't done meaningful tort reform that takes some of the defensive medicine out of the formula. And we just basically said, we're going to make you buy it, kind of like you do car insurance. And if you're an employer and you got over 50 people, you're going to have to provide it. And so we started doing some things that I think are counterintuitive to our free enterprise system. We took away freedoms. And we told businesses what they must do. And at the end of the day, and then we subsidized, in some cases, up to 138% of federal poverty level, which was a total misread on what Medicaid was in the beginning. And now we have added all this expense to those that did it, Arkansas being one of those. And it's just not a sustainable formula. It's going to bankrupt the country. If it hasn't already, if the entitlement programs in this country are not at this time capable of bankrupting the country, they soon will be. But I'm going to tell you, they're well on their way to doing it now.
Do you consider Social Security an entitlement program?
By definition, it is an entitlement program because you get it when you achieve a certain age.
Yeah, but how much were we all paying into it? So
Okay.
it's like we're owed.
I understand. Man, I really understand. We're not asking the right question. where it concerns the long-term sustainability. And let me repeat the question. You know, do I consider Social Security an entitlement program? And I said, by definition, it is, because once you hit 62, you qualify. In some cases, before. We're not asking the right question. The question is, what are we taking out of it? Not what Raymond Mayo is taking out of it, or not what you're taking out of it, but as a country, what are we taking out of it?
We borrow against it all the time.
Okay, now let me tell you what we're taking out of it. We're taking out of it, in the aggregate, a lot more than we ever put in. Now, does anybody want to take that on as a business venture? That's not a real, that is not sustainable. Here's why. It was developed in the 1930s, Social Security, Medicare in the 60s. At that time, what was the average lifespan? 60, 65. Some lived longer, some a lot shorter. But the point is, the construct of the program was developed over data that shows here's how long people are going to live on average. And that actuarial table was built around that lifespan. So the program hasn't changed substantially, but one thing relative to lifespan has changed substantially. So now what are people living to? I think 79 or 80 is now that right number. So if you run this out on an actuarial study, you will see, and this is what the Social Security Administration does, which is why they say in 2032, 2033, somewhere in there, we're not going to have enough money to pay the benefits. That used to sound like a long time off. It's not anymore. But if you look at the actuarial studies on Social Security, and you can do the same on Medicare, it's going to run out of money from people that there are going to be more beneficiaries than there are people working to support it. And so that's why I continue to say it's not sustainable in its present form. There's a young lady right here with a love her already. She's a Cardinal fan. There's a young lady back here, and I know it's not proper to guess ages, but I'm saying you're 25? Almost 25? Can this young lady say with certainty today what the social safety net program is going to be for her when she's 40 years older? No. All we can tell her is we know it's not going to be what we have now because there's not going to be enough money to pay the benefits. And Congress is going to have to do something about it. I think we should have already done it so she can plan her life around it. And I'm not fighting the problem. I'm just saying that it's an entitlement because you get it automatically upon achieving a certain age. In this case, 62. For Medicare, it's 65. There are other entitlements out there like food stamps or supplemental nutrition. If your income is X, you automatically get this. There's an exceptional qualifier. If you get low-income heating assistance, you automatically get food stamps. So there are qualifiers. That's why they're entitled to it. And I think we've got to do it differently so that we can afford it in the long haul and be able to have something in the out years for the younger generation. Now, I want to be careful to say this. Nobody, not me or anybody, is advocating that we cut any benefits that you qualify for, that you built your life around. Nobody's trying to shove you over the cliff in a wheelchair.
I'm not the least bit concerned.
But, and God bless you for that, but nobody is saying we're going to do something to present seniors or people nearing that retirement age because they built their life around it. What we are saying is we better do something, and we better let the people that are going to be doing this in 30 or 40 years from now know exactly what the program is going to look like so they can build their lives around that program. The Congress just hasn't done it. So tough subjects, hard to deal with partly because of rhetoric, partly because of polarization, but also partly because of the lobbies that come after you when you start talking about these kinds of things. Like let's just say for the grins, Steve Womack stood up in Pindall, Arkansas today and said, I think to save Social Security, we ought to raise the retirement age, the minimum retirement age to 66, and full retirement age to 70. Let's just say I said that today, and somebody tweeted it. I'd have the AARP, and I'd have all these other people, you know, senior groups. I mean, I'd have them camped on my doorstep, wanting to talk to me about my position on this thing.
I turn 65 next year, so hold off on it.
Yeah. So,
Next year.
these are tough decisions, and they become extremely difficult to do politically. But the country is 20 trillion in debt. It's going to have a budget deficit this year of $500 billion. And if we continue to spend money on the glide path we're on right now, which is one of the reasons I want to do budget, Joe, is because I'd like to be able to bend that curve. And we're going to be spending $1 trillion a year more than what we take in, and that 20 trillion will go to 25 trillion pretty quickly. And that's just hard to justify putting that on the shoulders of this 24-year-old sitting over here. She's going to have to pay for it. All right, right here. Yes, ma'am.
So I've been to a lot of these things that
You
you do.
sure have. I've seen
Yeah,
it.
okay. And today, I wanted to bring some dreamers with me, but they don't like you because they think you are a racist. So, what I would like to know...
Racist?
Yes,
Based on what?
a lot of things. I could name a few, but I'm not going to go there right
Go
now.
ahead. Take a shot.
Really? Ignoring me at literally every town hall I've been to. Ignoring me the other day when you were in Peel and you just walked away from me, even when I told you, like, will you please answer my question? I was highly respectful to you.
You think that's racist? You're not the only person.
Are you really going to question me about that?
No, I just don't. I don't
I
think that's a great definition.
I don't really think that
I
you
don't think
have
that's
the
a
right
real
to
good
the
qualifier
opinion
for
on
racist.
whether I, a black woman, think that something you
Right.
did or said was racist.
Let's have
But
your
that's
question.
not my question.
All right, let's have your
My question is, you're just telling this man that Social Security is going to run out by 2032. And yet, Donald Trump and Jeff Sessions just rescinded DACA. Okay? Those kids who were brought here through no choice of their own, they didn't choose to come here, their parents brought them here, will contribute to Social Security. They will
Some
contribute.
cases are.
For now.
Yeah.
For now.
Yeah.
Okay. And they will, and there's enough of them here to actually stabilize Social Security. There's, what, 800,000, I think. And there's more that we're holding off. Okay? So they don't even get to collect it. So that's like money that goes into the coffers of Social Security that the people who are putting it there don't even get to collect. So what are you going to do to protect Social Security, protect DACA when those two things are together?
Okay. Well, first of all, DACA is a program designed to benefit a fenced group of people. Numbers are roughly around
Children who were brought here.
800,000.
Children who were brought here by their parents. That's who it is protecting.
Let him answer the question.
Let me answer your question.
Well, I just want to make sure
I
you
don't need
know
to be-
who the
I don't
people
need
are.
to be schooled on DACA.
Well, I don't need to be
understand
schooled
DACA.
on everything you school us on, so,
No,
you know.
I'm just
Let
letting-
him
let
answer
me
the question.
answer your question. I don't need to be schooled on DACA. I understand what DACA is. It's a group of people that have been afforded certain protections, and quite frankly, I have a heart for them. I do. So, you know, do I think that, is there any question about their legal status? Not really. They were brought here by people who were undocumented. They were not in a position to influence that decision because they were kids. So I have a heart for people that fit into that category. My heart doesn't bleed near as much for the people that brought them here because they made a decision to violate the laws of a sovereign country, the United States of America.
We're not asking about the
Ma'am,
people who
let
brought
him
them here.
answer the
He's
question.
not answering my question.
No, he-
Answer my question by telling me how you are going to protect people who were brought here
Okay.
when they were children. That's the only answer I need from you. I don't
Let me
need.
tell you something. If you
Okay.
interrupt me one more time, then you're going to have to get your information somewhere else because I'm not going to let you interrupt me time and time again like you always do, which is
Then
precisely why I never
answer
call
my
you.
question.
It's why you don't get called on because you become obnoxious with your interruptions.
Then
And
answer
to be
my
fair,
question.
let me finish my
Okay.
question. So young people that came through no fault of theirs have a real predicament. They know no other country but this one. They speak the language. in virtually every way except birthright citizenship, they are like us. They were brought here by people, their parents or others that were undocumented. So it is a problem that has festered over a long period of time, involving multiple presidencies and multiple Congresses. So what I have said before, in the overall scheme of reforms on the immigration program, which our country desperately needs to address, that hopefully the need for better border security, the wall, other measures involving border security, troops on the ground, call it whatever it is, but a better border security package that can reduce the incidence of people coming into this country undocumented and basically sneaking into the country can be resolved, and maybe it's the DACA program that can finally get us there. So that's why I said in response to this gentleman's question earlier that the deal he is trying to craft that deals with border security, which was a huge, huge issue for the president, can be met if we're not going to get it out of the Republicans, that maybe the poker chip, this being DACA, can be the way that we finally get the border security that this country deserves. And that's what I support. I support a very strong border security initiative, not necessarily a wall along those hundreds of miles. There's other ways to do border security, but I want this country to have an established security barrier that makes it virtually impossible for people to come into this country without documentation and subsist off the benefits of a very generous country without legal justification. DACA may be that chip that the president can use to get ultimately a better border security package. And then I think if we do that, it opens the door for a lot of other issues regarding immigration, like the visa programs, the entry-exit programs, guest worker. We're already talking about visas. So, I mean, there's a myriad of things out there that need to be in the discussion. But I think border security has to come first, and maybe the way to get it there is to give relief to the DACA kids as an argument in exchange for some border security. So we'll see. Now, if Schumer and Pelosi want to go along with a great border security package, then I say let's have that discussion.
So you want to use DACA kids, dreamers, as a bargaining chip. So what you're saying is, if we get border security, then I might be willing to give more rights to the dreamers who were brought here, didn't ask to come here, they were just brought here. When all you really have to say is, I support the dreamers and I believe they should be able to stay here because they did not choose to come
But
here.
you're not going to put words in my mouth.
I'm not. I'm asking you to tell me if
And I'm
you
not
agree
gonna
with
say
that
that.
statement. Of course you're
I'm
not.
not gonna
Okay,
say
no,
that.
you're good. You answered my question.
Okay.
Thank you.
All right. Back here in the back, yes, sir.
Couple of quick questions. I have been, of course, on Social Security Advantage plans ever since I got 65, and that's been a while. It seems those things are getting less and less before you can do anything with them. What's going to happen?
On the what plan?
The Medicare Advantage
Medicare
plans.
Advantage. You said
I have
Social
never took Social Security. I signed on with an Advantage plan first off because I like what they did.
No, you're confusing. You've never taken Medicare.
I've never taken Medicare.
Medicare. You said Social Security.
Yeah, I'm sorry, I've never taken Medicare because I like the advantage of the Advantage plan.
Yeah.
It puts me responsible for my own health care, in other words.
And I kinda like
Make
that.
some choices, and I make some co-pays when I go. But what do you think about those? What's gonna be done with those things, and what are you gonna do to help us a little bit with those? And then another thing, what do you think about this Graham Cassidy bill that's being put up right now?
All right, let me take the last part first.
Okay.
I'm a big federalism kind of guy. I believe in states' rights. I'm a 10th Amendment guy. I just believe that the more states are different, populations are different, the more we can devolve to the states on these federal programs, the better off we are. I've been around Washington now 7 years, long enough to know that any program that is executed and run solely by the United States government is probably as inefficient a way to do things as you can get. And we can go into many, many details across the spectrum of government. not just healthcare, but DOD, other things. We spend and waste a lot of money, not an efficient way. So anytime I get an opportunity to empower the states to use the money from the federal government, it's the devolving of power down from Washington to the states, I think it's a better deal. I just do. Graham Cassidy is built around the notion that we're going to empower more states. But I do think that we have some obligations out there regarding how, in writing some of those rules, like you can't just leave people out in the cold, and you can't develop, a state can't develop a healthcare system that disenfranchises unnecessarily certain population groups or minorities or people with pre-existing conditions, those kinds of. We got to work within the framework of what is right, what is decent, and what is affordable over the long term. And ultimately, healthcare has to be written in such a way that we make it more accessible and that we bring down the cost associated with premiums and deductibles so that people can actually access it. Now, you talked about Medicare Advantage. I'm a fan of Medicare Advantage because I believe that people should seize more control of their own health care. Now, I take care of myself. I make personal decisions about exercise and about diet and about not putting things into my body that really don't belong there because I want to live a lot longer. But I also, from a purely private citizen point of view, recognizing the deficits that we're running, I don't want Steve Womack to be somebody that's always taking money from the U.S. government to, shall we say, subsidize or be the panacea for maybe my bad decisions. And I'll just say it. You know, I don't want to offend people in this room that smoke. My wife smokes. But I personally don't think that Steve Womack ought to have to be paying for the problems brought on by other people that practice the kind of behavior, drugs, smoking, alcoholism. You can just go through the litany. Why is all of a sudden that my responsibility? I'm trying to do the right thing. That's why when I go to work every day, and I hope I earn my pay, and before I was a member of Congress, I was a mayor, and I worked my tail off there. Before that, I was a broker at Merrill Lynch. Before that, I was a broadcaster. I would hope that, I've never, other than the paycheck I get and the benefits that accrue to me because of my job, I've never taken a government handout. I don't want to be, I've got enough pride in me, I don't want to be a person that is a lien on my government. I want to be a producer. And I want more people to start making behavioral decisions out here that make them more of a producer and less of somebody that's having to take from their government because we're $20 trillion in debt. So, I mean, I just have some really, it's why when we got into the discussion of food stamps and the work requirements and then the work requirements on the AHCA for Medicaid, I believe strongly if you're getting government subsidies and you're able-bodied without dependents, you ought to work. You ought to work. And you know what? If you're from my neck of the woods, over on the 49 corridor, and you don't have a job, it's because you don't want to work. Because the unemployment rate over there is about 2%. It's probably not much higher than that over here. And we could probably drive up the road to Harrison and go store to store to store and find people, business owners, begging for people to come to work. And yet we've got policies in this country that pay people not to work. To get free food, to get free housing, to get free health care. And a lot of these folks are able-bodied and could be making a contribution. Now, I'm going to tell you this. You didn't ask about this, but I go to a lot of businesses. And you can go to any of them yourself. Sit down with the CEO of the company, the owner, or the HR manager, and say, what's the hardest part about sustaining your business? And I promise you, they're going to say, workforce. Can't find people willing to work.
two things, workforce and taxes, that's Jerry and me both. We're both old men and should have retired years ago.
But it's workforce. It's workforce. And when I dig into workforce, you know what they tell me? They say the problem I have is if I do find somebody that might have even close to the skills that I'm looking for, they may not be able to pass a drug test. Or they may show up today and tomorrow morning they never show. And it's because I think, not in every case, but in a lot of cases, policies of this country have suppressed the initiative on the part of the typical American worker to get his butt out of bed in the morning, roll up his sleeves, and go out here and work. And try to improve their situation with every move they make. But they get consumed by the baggage that they tie around their own neck. Maybe getting married too soon. You know, having a drug issue or an issue with alcohol, or you can just go through the whole deal. And I had this conversation the other day with a group of people, and I want to share it with you. Sometimes it's just because we don't ask the right questions. So here's a question for you. Why are successful people successful? Help me with that. Why? Why?
Going to work is part of it.
Why was Sam Walton successful? He had an idea. We all have ideas. But he rolled up his sleeves every day. He took a lot of risk. Man, did this guy take a lot of risk. He did things, he chased his dream, and he chased it because he was a hard working person. And he enjoyed the spoils of his labors. So why are successful people successful? Primarily because they make really good personal decisions. They get their education. They take care of their health. They develop leadership traits, and they have ideas, and they incubate those ideas, and then they work on them and take a little more risk, and pretty soon they expand and good things happen, and it's infectious. It helps a lot of people. So now that we've answered that question, let me ask you this question. Why are, and I don't want to just say poor people, but why are the less successful not so successful? Not in every case, but in many cases, when you peel back the layers of the onion on the question, you find out that they didn't do the things that the successful guy did. They made decisions in their personal life that were not, that did not, shall we say, guarantee them or ensure them some measure of success going forward.